Welcome to the Talking HealthTech podcast. My name is Peter Birch. We're here for a special live recording of the podcast. We've got a virtual audience that's in attendance. If you're here, drop a message in the chat. Let us know where you're joining from, why you're joining, and say hello. If you're listening to the podcast, then make sure you subscribe to the Talking HealthTech newsletter so you can find out the next time we do a live recording like this, because you can really help shape the conversation and get a mention on the podcast too, which is kind of cool. So I'm in this episode, we're finding out can digital clinical solutions enhance retention and recruitment of clinicians? And that topic of retention and recruitment of clinicians and keeping them engaged is always a hot one. But then that role of technology and digital health, how does that kind of tie in? Does it help? Does it hinder? Let's explore it a little bit more. I am lucky enough to be joined by two individuals that hold this topic passionately close to them. I've got Steven Parrish and I've got Viti Handyside, both from Dedalus. Hey team, how you going?
Very good, thanks, Peter.
Always a pleasure. It's good to have a returning guest like Steven. I think it's like a coffee card where you get, if you do like 6 and you tick them off, you get the 6th one free. But and Viti is... And then we've got Viti as well. It might be helpful actually, firstly, before we dive into this topic that we're discussing, if you can both give some context in terms of the work you do and perhaps how it ties in with this topic before we get into it a little bit more. So, Steven, firstly, can you introduce yourself a bit more?
Yeah, hi everyone. So, Steven Parrish, I'm the Chief Clinical Information Officer for Dedalus. Been in healthcare for way too long, thus my receding hairline. But been in digital health for over 20 years, healthcare over 30 years. Worked both in vendor side, public-private, and the customer side. Have seen the challenges with recruitment and retention of clinicians over the years. And from what I've researched, it's going to get worse before it gets better. So I think it's something we need to be having a conversation about, and something that digital can help, but perhaps not in all the ways you might think. But yeah, let's talk about that.
Absolutely. Keen to do that a bit more. And Viti, a little bit about yourself, please.
Thanks, Peter. So I am, as my banner there says, the product manager for the ORBIS EMR. So my job really is to look at what can an EMR or should an EMR be doing, and how can it be designed in order to deliver the best benefit to both an organisation but the clinicians who are using it. Now, this is something I hold very dear to my heart because my background is that I'm a nurse, so I've worked clinically for too long to mention on this because I don't want to give away how old I am. But as part of that work, it has been very key to understand what clinicians need from an EMR and then how that can then help to support them in what they do, reduce their burnout, help them to engage with their work and their patients, and really keep them focused on what they've got to do.
Yeah, got you. Well, look, keen to dive into a bit more. So, Steven, when we talk about clinicians, it's a good catch-all term, but maybe it would be helpful for us to kind of drill down a little bit more, because in a healthcare setting, there's obviously a lot of different clinical roles. Where are you seeing that this is kind of most relevant? What kind of clinical groups are we talking about?
Yeah, it's relevant across the board. I mean, the World Health Organization have estimated there'd be a shortage of 14 million clinicians across the world by 2030. And that includes doctors and nurses and allied health, whether it be pharmacists or other groups, but anyone that acts clinically in a role in a healthcare setting. Just even within Australia, Health Workforce Australia suggests that there'll be 100,000 nurse shortage by 2025. It's only next year, so that's significant when it comes to the shortage of professionals in healthcare to do the work that we rely on every day in our organisations.
Yeah, absolutely. And it's, one that is, it's a global challenge, as you suggest, and it's across all the different disciplines too. So, what, but why, I guess, is my question too. Where there's no wherever you go in the world, there's no shortage of ways to train up clinicians and programs and courses, and everyone kind of talks about it, but what's really driving those concerns around retention and recruitment of clinical staff?
But when you think about the training mechanisms we have in place, for a nurse, it's 3 to 4 years from entering the university to when you become a registered nurse and be able to then work in the organisations. For doctors, it's a lot longer than that. And the places, while they have increased, have not increased in line with the need of having all vacancies in the workforce. We also have an ageing workforce, so we have a large retirement cliff coming our way with people growing older. The average age of a nurse in Australia is in the 50s now. So, that means that people are going to retire and move out of the workforce, and we just don't have the volume of people coming into the workforce to replace them. Historically, we've used immigration as the main way to get people into the workforce in Australia. We're finding that there's countries really, blocking that. So Ireland at the moment is looking to block the ability for nurses to come to Australia because they have their own challenges within Ireland. So we are looking to try and bolster our workforce by overseas workers. But again, when there's a worldwide problem with the sheer numbers that we need, the only option is to either train more when we don't have people that are available to do the training or not the same numbers we need, or to do things differently. So workflows need to change. We need to look at other ways of working, working at the higher scope of your practice as well, so that we can take tasks that we normally do and apply them to other skilled people. So there's ways of doing it, but very much digital has to take part in that as well, making it simpler for people to do their job, making the ability for technology to support the workflow, not to detract from the workflow, and increase satisfaction in the workforce of what people are doing today. And organisations almost need to be destinations in their own way to say that we are the best at what we do so that clinicians want to work there. And that's going to increase competition within facilities, especially in metro areas where you might have 5 or 6 hospitals within spitting distance of each other or within kilometres of each other. People have options and choice of where they want to work. So you need to create an organisation that values people, that values technology, and uses it the right way for the best outcomes.
Yeah, that's right. And we're lucky enough to be joined by, people with clinical experiences. And, as Steven was mentioning, there's challenges in terms of demographics, and Viti, as a younger nurse that's come through the process, how have you found it? Like because as everyone in a clinical role, I find sometimes that they look at different ways that they can kind of bolster their career or get value from it. Like, what's that personal experience like for you?
Yeah, I think that it's very much, as Steven was saying, one of the key things that we have to do in ensuring that we're able to recruit staff and we're able to retain them is not just about getting them through and getting them trained, but it's also about providing them with opportunities to be able to engage with that career and stay with it. So we need to make sure that we're providing them with opportunities to, for example, get further training, specialise in areas and look at, how does that engage those clinicians and keep them working? How can we make sure that the way that we're making them work, the workflows that they're doing, the way that they have to communicate with each other, the tasks that they have to do, how can they be really efficient and streamlined? All of those things, I think, really contribute to nurses and all clinicians really wanting to stay within their profession. If you can give somebody a profession experience where they are well supported, they're offered opportunities to be able to improve, and they're given the access to the information and to the support that they need to stay engaged, it really helps to make them happy to continue working in that career, but also reduces the likelihood that they're going to get burnt out and that they're going to then want to leave that clinical role and go and look for something else.
Yeah. I mean, that's the worst when, from a clinician's point of view, where, the conversation around burnout happens, and one of the biggest contributors is that additional pressure that's been placed on clinicians around collecting information. Essentially, the technology, if it's been implemented without that kind of forethought, has contributed to the issue, and that's not where we want it to be. We want it the other way around, where the size of the pie in terms of the total amount of clinicians that exist around the world is, if that's not going to get bigger, or the allocation of it isn't going to help, we're going to need to be able to think more intelligently about it. And I think about Australia specifically, Steven, we talk about how it's a challenge here in Australia, but you mentioned it's a global one as well. And from my experience, it's almost like at a bigger scale. Is that right?
Oh, absolutely. And you just look at some of the traditional digital-enabled countries like America, where you'd think that from a digital perspective, they're well supported in technology. They've had legislation that's driven the uptake of EMRs. They're driving the alignment between primary and secondary care as well. And you'd think that they'd have it right by now. But the reality is, and I was reading an article just this week about clinician burnout, and how it's increasing at alarming rates in the US. And that comes down to the tools they're using not really being aligned with the way they work. They'd be more focused on the data, on the billing, on those components. Whereas I firmly believe, and Viti and I have discussed this, is that anything we do from a data perspective should be a byproduct of the workflow that clinicians doing at the time, and supported by technology. It's not a focus. The data should not be the focus. The focus should be what they need to do their job and to support their patients clinically. The output of that should be the data that we use in billing and other components. And that's really key. I mean, the US, when I was working over there, it was a beginning of physician assistants coming in and scribes coming in, because the EMRs were creating so much challenge with their workflow that in ED, they'd employ someone to walk behind the doctor and just scribe everything the doctor did, so the doctor didn't have to work in the EMR. We have physician assistants as a profession that's come in the US and is starting to permeate other countries as well. And I'd argue that came out predominantly because of that investment in technology and the impetus and the pressure it put on clinicians to work harder and faster and try to be more efficient while utilising tools that weren't necessarily aligned with the way they work. So I think that's key. It's about supporting the clinician in doing their job, not trying to force a clinician to do it a certain way necessarily.
Yeah. Now that's it's interesting how those different roles have evolved, probably coming out of those points that you mentioned, and that then requires thinking on different models of care and the way we do things and the technology. And I can see in the chat, Richard's brought up this point about the opportunity to bring in different virtual models of care and hybrid and messaging-based services as well. So anyone that's in the chat too that has questions and comments, you can help shape this conversation, because we might dive into Richard's point in a little bit. But I wanted to stick with this one for a second, because we're talking about the need the role of clinical software in addressing some of these issues, Viti. So when you're kind of doing what you do within Dedalus, where are you kind of placing your goals around these clinical software solutions to address some of these issues?
So as a product manager, if you ask me sort of what's the goal of a clinical software solution, my answer is going to be to save the world. We can do everything. But look, I can, at a very high level, the idea of these clinical software solutions should be to enhance the accuracy, the safety and the efficiency of healthcare services. We need to ensure that along with the fact that we want the patients at the heart of healthcare delivery are our key sort of goals. Now, how do we do that? Well, there's lots of things that we can do in order to deliver that outcome. As Steven's mentioned, we want to streamline workflows, simply by, for example, automating clinical processes that can be automated, reducing administrative burden. That allows our healthcare providers to focus much more on patient care and much less on the administrative tasks that often cause them a lot of stress. We want to improve patient outcomes. So if we can get tools that are able to provide better data collection, data management, provide clinical decision support, coordinate care, then what that does is pulls together to produce a safer care environment for our patients. Things like interoperability. Are we creating solutions that allow the seamless sharing of information between different healthcare systems so that we've got comprehensive information about our patients that's accessible to our healthcare professionals and they can make really well-informed decisions? Data analytics, making sure that we comply with regulations so that we're meeting our regulatory requirements and clinicians and healthcare facilities, can drive better outcomes that way. And on a broader sense, especially for a country like Australia, are we developing clinical solutions that enable clinicians to work remotely, but also to deliver care to remote areas? We're a big country with a very small population spread all over the place. So have we got those IT solutions so that we can focus on providing care equally across our entire country?
I mean, those points all resonate with me and make a lot of sense. And that in itself, as you started listing out those stakeholders, there's a lot of different people that kind of need to be served or are, I guess, need to be designed for. It would be lovely if you just had a single avatar as a product manager to say, I'm designing this product for this particular person. But I guess then you wouldn't be able to save the world, as you mentioned earlier, if it was just that small a goal. So how do you go about thinking around, well, like, hey, we're going to prioritize and we've got to design for somebody. So who are you really designing these solutions for?
I think the simplest way to think about it is clinical contributors. So an EHR needs to be designed in order to allow everybody who is going to contribute to that clinical care to be able to interact with it. Now, often when we think of clinicians, or we use that clinician definition, our minds automatically go to the very traditional roles: doctors, nurses, allied health providers. But we all know that healthcare is moving outside of that very strict formal hospital environment, and it's now being delivered in communities. People are delivering it in homes. We've got people of varying different levels of qualification. We've got carers, community-based organisations. Patients themselves now are very heavily interacting with their healthcare and with their healthcare providers. So all of those different roles, all of those different sort of backgrounds come into play when we are trying to design an EHR and look at those clinical contributors. And one of our biggest challenges is, because that environment and that landscape is so diverse, it means we don't have that single persona or that avatar that we're designing for. And we need to put on a lot of different hats when we're considering those workflows and those journeys to make sure that what we are designing fits the needs of everybody who is going to have to interact with that software.
Yeah, it'd be lovely to have a single piece of reference material to be able to then determine how it's going. And actually, I can see in the chat too, Derek has put up a question about whether there's any published surveys or research papers in Australia on clinician satisfaction with EMR use. And I don't know, actually. My mind goes to there are papers and reviews, and I'm interested in both of your thoughts. But I know, that the work that Claire Sullivan does is a lot focused on, up in Queensland, is focused on the return on investment of some of these solutions and some other areas as well. But I guess in building on that question from Derek and going to either of you, Viti and Steven, how do you go about ensuring that satisfaction? You touched on the co-design piece and the working with the clinicians, but how do you know if you're actually doing a good job, I guess?
Well, I guess clinicians smile a lot. That's one way of knowing whether you're doing a good job. But the reality is you have to ask. You need to listen to the customers. You need to listen to the clinical cohorts, have the conversations with them, go around and do, stand side by side as they work and listen to what they have to say. Now, there has been some research done. There was a paper published, I think, last year by Griffith University around the satisfaction of EMRs, and they looked at both primary care EMRs and secondary tertiary care EMRs. Interestingly, they found that in primary care, doctors are happy and nurses are unhappy, and it is reverse in the tertiary and secondary care, where the nurses are more happy and the doctors are less happy. So that was an interesting article, well worth looking into if you're interested in that. And yeah, there was a review of Melbourne Children's as well. I think the challenge is you only usually hear about the bad stories because that's what people like to tell. The good stories are harder to hear, but definitely you have to talk to people. You can't go about this job in or even this industry, any industry, without talking to the end users and understanding what their pain points are and adapting to that. And we do that. We have clinicians on staff that work with our UX designers. Part of that is looking at dashboards, how we present information a lot better for clinicians to consume that in a structured and in a relevant way to what they're doing and how they work. We look at use of AI as well, so ambient listening, so creating doctor's notes and patient notes from listening to a conversation between a doctor and a clinician and a patient. We're looking at discharge summaries being built through utilizing AI, so pulling bits from the record in order to go to discharge summary that's then collated by AI, but then approved by a clinician. So there's many ways that we can use technology to enhance clinical care, and I guess take some of the onus off the clinicians as being a collaborator of information to being an approver of what's already collaborated for them, and so they can just make tweaks as opposed to having to put it all together themselves.
Yeah. And I can see here in the chat too that Coralie has mentioned that, that also another big challenge is that gap between primary and tertiary care within the healthcare systems. And, sometimes it feels like they operate, like all across the healthcare continuum can feel like operating in silos a little bit. But I guess actually building on some of the previous, because we've done a few of these live recordings with Dedalus and seeing some of the solutions in the areas that you play in. So that has come through to, that I've understood anyway, that's something that you guys are quite conscious of, is how do you kind of follow a patient through that patient journey wherever possible. Also, but also keeping in mind that the healthcare landscape is riddled with legacy technology, different systems, and you've got to make do with your best. But based on Coralie's point, does that kind of resonate with you, Viti?
Yeah, absolutely. And as a clinician, I worked quite extensively rurally. So, working in rural facilities, what you find is not only do you have a lot of your processes on paper, so that can make it very difficult to share that information, but you are also, because you're geographically isolated, can have access problems to technology. And so where there may be a system that you can possibly access to, look at a patient's information, find out what happened when they were sent away to a major tertiary hospital. Sometimes accessing that can be very difficult. So from our point of view, being able to share that information, having that ability to offer that integration so that information can flow from a primary care setting into, a hospital setting and then back out as the patient then returns to the community and perhaps goes through rehabilitation is really key. And it's one of the reasons why, as we sort of look at EMRs and we look at how can they actually help with our staff retention and with our clinician experience, one of the things that's really stressful for clinicians is when they don't have that complete picture on their patient, or they have a lot of difficulty accessing that information. And so, as within product management, that's something that we need to keep in mind, and we really need to map those end-to-end workflows, those broad journeys, and keep that in mind as we're building the product and designing it for the clinicians and the real lived experience of the patients.
Yeah. Actually, just building on that too, I can see Karthikeyan has mentioned that, digital healthcare or healthcare IT was once, just a very inward-facing industry of vendors and hospitals, but you touched on that point of a big contributor towards the recruitment and retention of clinicians is that stress that a clinician might face in having the full picture from the patient. Increasingly, we're seeing that there's more and more information that the patient will want to contribute to their healthcare journey. And Karthikeyan has pointed that out, that there's definitely a need for us to evolve just beyond that kind of the behind-the-scenes space. I imagine too, Viti, that the pulling in the patient's perspective wherever possible and keeping them engaged is all part of the journey for you too?
Absolutely. Patients need to be at the centre of the provision of healthcare. It's not something we should be doing to them, it's something we should be doing with them. And that's very much how we need to look at it when we're collecting and sharing information. It's not something that clinical systems should be hoarding and keeping for the clinicians. It's something that we need to be sharing through things like access through patient portals, providing the ability for any clinical contributor to be able to access that information on any device, whether you've got a phone, whether you've got a tablet or a desktop. How can we allow them easy access to that information? And that's all those clinical contributors, so that they can keep a clear picture of not only what's being done, but where we're going with that clinical treatment.
Yeah. So then, taking all that into consideration then, Steven, that's the landscape, and there's some of the opportunities you did touch on. There's some things that are being worked on. There's emerging technologies. I've heard about this thing called AI, and there's also lots of other, I guess, different competing priorities when you think about the kind of big picture, what the future looks like, given all those learnings around the challenges in recruitment and retention of clinician. Where do you see this all playing out and the role that technology plays?
I think AI, I love AI. I'm a geek by heart, so any new technology I tend to get excited by. But AI is one of those catch cries of the moment, similar to what cloud used to be and other things, where I think we overutilize the term AI and we don't always understand what that means. So definitely something that can play a part in the future and is key to enhancing the experience of a clinician by augmenting what they do through an artificial intelligence function. Now, governance is key on that. We've got to make sure it's governed well, that it's used in the right way, that we don't get false positives and false negatives. There's lots of research out there that shows the downside of utilizing AI. So we need to get that balance right. So that's one aspect of what we can do. The other aspect is, as I said earlier, is designing systems that enhance the workflow of a clinician and of a patient through the system, making sure that we remove any of those duplicate things that people do. So documenting in multiple places, the same thing in multiple places, making sure that the clinician can consume the information in a very succinct way and not have to go looking for it. Traditional EMRs, if you wanted to get a picture of a patient, you're looking at 5 or 6 different screens to then remember the information to then apply to the notes you're writing and around the patient that you're conversing with. So there are some real challenges in the way we historically have done things. I think also just generally we think we focus the workflows around patients, but the reality is we focus our workflows around the way we want clinicians to work. And we need to somehow marry that up to ensure that we can cater off both needs at the same time. We have to keep the patient engaged. We have to get the data that we need in the view of the clinician to make the right decisions as quickly as possible. We need that augmented by technology, being AI or dashboards or other mechanisms or other technologies that might come up, be it telehealth. Telehealth through COVID was an amazing thing. But as soon as COVID stopped, the use of telehealth died. And I was talking to clinicians and they were like, but I had to do it then. Don't have to use it now. So I went back to the old way of working. So we have to incentivize that. We need the funding mechanisms to align with the way we want to work in the future. I've got an example just this week. I need to go to my GP because I need a script filled. It's a script I've had been back in Australia 3 years. I have it every 3 months for 3 years. It hasn't changed. But I have to spend $85 to go to a GP to get a script filled, even though the GP knows me and there's no mechanism for me to do it virtually without me now having to ring the doctor's practice and rebook an appointment to get that. When I was in New Zealand for 5 years, I could go on an app, I could say, I need this prescription refilled. I'd then apply to get it refilled. They would then let me know whether they needed to see me for that. So it turned things around. I can't do that for my GP here in Australia. So, and I can use third parties, but again, they don't know me. It forces me to have a consultation at an increased cost. In New Zealand, it cost me $15 to get a script filled through a GP, not $85 over here. So, there's ways that we can work better and smarter. And yet I'm a Kiwi, so I absolutely agree, Richard. There are ways that we can do things better, but the legislation, the funding needs to follow those ways. After COVID, the Medicare rebate for telehealth stopped. There's a whole lot of things that as a system we need to change to make it better and more usable. And don't get me started on the state federal divide as well, because that's another whole conversation we could go into. And I'll stop. Get off my soapbox there and let Viti talk.
Yeah, well, actually, just to and I think that's an important one to reiterate too, because we can continue to, have isolated little islands of services that can provide a really slick service that feels like a very consumer, product on an app that can deliver things, and it's probably going to be out of pocket, but it's probably also going to be happening outside of the healthcare system. But if we could get to a point where, I think everyone in healthcare has agreed that, there does need to be a good blend of in-person and virtual elements of a healthcare system but it all needs to kind of be tied together. If we continue to fragment it further with a lot of isolated solutions that don't kind of tie in, then we're only really compounding issues. And it can be confusing for us when we're, working in the industry, let alone, someone that doesn't take that as a priority. They just want to get on and be healthy. But Viti, focus on product, particularly on the ORBIS EMR. Where is your kind of gaze into the distance? And I assume quite aligned with Steven's thinking as well.
It is. And look, a lot of the sexy technology stuff that we get very excited about is fantastic. AI and how we can use that to streamline workflows and automate things is fantastic. But there's also a whole host of really simple, I think, design ideas and steps that we can take that also make a really huge difference. Just simple things like clinical care is founded on communication. So how can we enhance communication between all the parties who are involved in healthcare? And really simple solutions to that is about providing things like apps or communication avenues within an EMR or between an EMR and a patient in the community through a patient portal that can really help with that communication and information sharing, because that's really key to making sure that our care is targeted, it's appropriate, and it's aligned with what the patient is trying to achieve. Things like making sure that we provide, a great workplace culture. EMR implementations and technology can help to signal to a workforce that the facility or that the provider is actually really committed to giving their staff an innovative environment to work in, that they're concerned and interested in making sure that the employee's well-being is promoted, and that their workplace is easier and simpler for them to navigate. So just simple things like that can really make a big difference. And I think that's where technology can really supplement and support that retention and that recruitment of staff.
Yeah. Love it. And I guess to really then hammer it home in terms of the topic at hand around the role that digital clinical solutions play in improving recruitment and retention. So obviously the passion rings through, and the clinical experience, and I guess the global awareness does as well from the Dedalus side. But are there some kind of key things that you really crystallize this point around the role that clinical solutions can play in improving recruitment and retention for us to wrap up the conversation?
Yeah, look, I think the key thing that we need to remember is that a clinical or a technology solution that is done well does great things. A clinical solution or a technology solution that's done poorly can be a disaster. And so from that perspective, there is lots of information out there that tells us not only do you need to make sure that from a product perspective that I'm providing a solution that's aligned to workflows and presents information in a way that clinicians need it and is safe and all of those things. We also need to make sure that we've got all of the supporting structures around that technology to make it work. So are we training? Are we investing in our staff sufficiently to make sure that they're trained and they're comfortable with the solution that we're delivering to them? Are we providing them the opportunity to be able to personalise that? So can we make it so that when they're interacting with this technology, they can develop templates or workflows or processes that suit how they work and the way that they want to work with that solution? You know, are we offering them options around, you know, how that solution is used within different clinical settings? All of those types of things, I think, in conjunction with the design of the EHR itself are really key.
Yeah, love it. And Steven, any other final thoughts to bring us out?
Yeah, I agree with what Viti has been talking about. I think the key for me is making sure clinicians are part of the conversation moving forward, making sure patients are part of the conversation, making sure that we can utilize technology to better enhance their workflow and the way they work. Increase the use of some of these cool technologies like AI in a very governed way to ensure that it's safe and effective. But also, I think, key for me is just having the conversation, just making sure at an organizational level you understand where the challenges are clinically, where technology can help with that, but where technology isn't the answer, because technology isn't always the answer. It's an enabler to a solution, and it helps. It can hinder. You have the best system in the world. If you implement it poorly, it's not the best system in the world. And reverse, you can get a lot out of a system that isn't great, but you implement it well and you really try to focus on enhancing how it works with your clinical staff. It can do good. I won't say great, but it can do good. So it's about making sure that you're part of the conversation, that clinicians are listened to, that their concerns are heard, and that you can work with your vendors to ensure that any solution you put forward does the best it can within the constraints that exist for both the software and the customer and how they work as well. Yeah,
I think you summed it up quite nicely there, and I think we'll close out the discussion there. It's been great to get your perspectives and get the feedback from those that attended live. This episode of the podcast will be released in the coming weeks, so make sure you subscribe so you can check it out, and do check also out the Dedalus listing on the Talking HealthTech website. There's quite a few episodes that kind of build on each other that can really contribute more to keep this conversation going, as Steven says. So, Steven, Viti, I really appreciate your time. Thank you so much.
Thanks, Peter. Thanks all.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.